Hello, everyone. I'm Crystal Bell, and for our special themed presentation for our Psychology of Addiction class, I am presenting on sex addiction. Main question: is sex addiction a disorder that needs to be added to the DSM? Through discussions with my special themed group and the articles we read, data suggests that yes, sexual disorders and addictions should be considered for the DSM. Let's start with terminology, where the debate continues just with diagnostic labels, such as sexual addiction, compulsive sexual behavior, hypersexuality, which no one seems to be able to land on a specific term. These are also related to other diagnoses such as internet addiction and compulsive buying addiction. However, for sexual disorders, none of these labels were considered for the fifth edition of the DSM. Relevance: are sex disorders addictions and or compulsive behavior issues or misdiagnosed hypersexuality? A question that arose within my group and within some of the articles that we read, such as the ones presented on this slide. Is it necessary to separate addiction from compulsion, being that it is often recognized that addiction tends to include compulsive behavior similar to gambling addiction, internet addiction, and compulsive buying? Part of the lack of clarity when it comes to relevance is also due to the fact that some people may just be experiencing healthy yet abnormally hypersexual behavior, which is unclear. Comorbidity: it is not abnormal to see more than one disorder within an individual. Data shows that there is comorbidity between sexual addictions and substance abuse disorders and other mental disorders such as ADHD. Data suggests that substance abuse and ADHD often lead to using self-soothing, self-medicating to cope with symptoms, which can have people turn to sexual disorders that do have similar symptoms but can become a coping tool itself, a result of and a symptom of ADHD, substance abuse, and other mental disorders. This obviously can raise the use of sex and sexual content as a tool for coping, which can lead to the sexual disorder becoming its own addiction with similar symptoms such as withdrawal. Treatment: multiple therapy approaches such as pharmacological and cognitive behavioral therapy seem to help, especially when they're already being applied to other disorders such as ADHD or substance abuse. And that has to do with similar chemicals working in those disorders that seem to tie in with sexual disorders, thus allowing the treatments and medications and cognitive behavioral therapies to work similarly on sexual disorders. A monotherapy approach tends to be less effective due to its inability to address the multiple layers and reoccurring connection between sexual disorders existing alongside other disorders. Data gap: this is a huge issue. There are enough people suffering from sexual disorders to take note, yet without any support or treatment, as it is not yet fully accepted into the DSM. There is still too little data inhibiting the treatment and support of sexual disorders, which sadly and unfortunately can lead to developing the disorder further and using other coping mechanisms in order to soothe the disorder, such as just things as shame and guilt, which ultimately creates a cycle of advancing and agitating all existing disorders. I would like to end this presentation with a quote from Goslar and colleagues written in 2020. Instead of sex being hidden in adult bookstores located in the outskirts of town, cyberspace provides an opportunity to enhance our own self-understanding with messages of virtual acceptance. The cyberspace culture provides a safe forum to be honest about one's sexual thoughts, which enables internet sex addicts to explore deeper parts of their sexual feelings. Ultimately, what this quote is suggesting is that to this day, disorders such as sexual disorders and other disorders are still taboo, making it difficult for those suffering from these disorders to seek out recovery, treatment, and support. What this also suggests is that similar to harm reduction processes, we might need to think outside of the traditional box of recovery, treatment, and care and become more inclusive, realizing that people need to feel accepted for the disorders that they're experiencing, which also could lead to gaining more data as to whether or not some people are even experiencing sexual disorder or they are just having healthy but societally abnormal hypersexual behavior. I want to thank everyone involved in my group, and I will end with a list of references. where these articles are what I pulled the direct quotes from that you will find on each slide. Thank you so much.